Let's go ahead and start.
Left out of that.
Okay. Roll
Yeah,
call.
roll call.
Okay, Mr.
Okay, here we go. Maggie Evans,
Chairman. Oh,
Dennis Wilson,
present.
Dan Maskin,
Here.
David Hahn Baker, not here. Michael Martin, not here. Patricia Cruz, not here. Andrea Ogunwumi,
Here.
Tina Zerbian, here. Jeff Lewis, not here. Miguel Santos, not here. Mike Bobbitt,
Here.
Maurice Reed,
Here.
Mynita Holly Atkinson, Eve Villas, Carlton Mitchell,
Here.
Belinda Groneman. There are 9 present. We do not have enough for quorum.
Nobody's on the phone except Pat.
No,
Thank you,
that's
Annette.
it. Okay.
Okay, so we can review the minutes from the previous meetings, but we can't approve them. So what's the council's pleasure?
Motion's reviewed, we can approve.
Okay. It's a nice segue into my report, which is filling vacancies on the council. Annette and I and Veronica had a conversation with the appointments attorney and Jim Leary, who's the attorney for the Department of State, and kind of came up with a strategy for talking about beginning to replace people who are on the council but have not been consistent with the bylaws, missing several meetings in a row, and all of that. We're all painfully aware of that. I think we're getting the ball rolling. There were 3 people who I attempted to contact. One replied back saying that she was willing to stay on, but is not here. The other said that she would resign, and the third one I didn't hear anything from. So at this point, Annette, has there been any next steps since that call?
Not that I'm aware of, no.
Okay. So the process is going. I don't have a whole lot other to talk about. Maybe a little bit of an Esprit update. We are, my agency has submitted its work plan and budget. It's been indicated to me that we were one of the first, and that there were many of the 16 cities haven't really completed the process yet. So they're going to wait until more of them come in before they start submitting them to the controller's office. So it's a little bit frustrating for us because we're pretty much all ready to go, but it might likely not be, for a few more weeks that we can get started with that. I haven't heard anything from any of the other cities at this point, but that seems to be where it's at.
Yes, I can. This is Andrea Ogunwumi. I'd like to speak to that. I do know in Elmira, the city of Elmira, we have submitted a plan, but have not heard back. I think there were a couple of questions of clarity around our plan, but that's where we are at this point. And the mayor's office is leading that initiative.
Okay, great. Okay. Veronica?
Yeah. So I want to thank everyone and welcome everyone to the meeting. It's always a pleasure to come to these meetings and see everyone and get a chance to share what's happening throughout the state, and of course to be together here. Now, I'm going to go through these. Some of them Tim will chime in, and so will Annette. But I want to start with our service projects. As you know, as part of the 16 City Esprit Initiative, we're adding on AmeriCorps, and we're doing VISTA. So that is that the division will be integrating the monitoring and regulating of a 16 city VISTA program and a 16 city AmeriCorps program. We are going to assign up to 134 AmeriCorps members to the 16 cities. The number will be divided up by population size. So there'll be some in more places than others. On the vistas, there'll just be 16 vistas. Both of these different programs will work together with the SPRI to take on anti-poverty initiatives in those areas. So in the process now of arranging to train our staff on how to monitor and regulate this program, these service programs, and then we're going to be training the sub-grantees in the expectation and issues of compliance regarding these two programs. Now, anybody have any questions about that?
So the 100 and some odd volunteers will be.
Yeah, 134 to be exact, actually.
Oh, okay, it's going to be based on population size.
Population size, MSYs
Okay.
is what they call them.
And is it up to the local ESPRI task force to create the strategy for them?
Yes,
Okay.
yes.
Okay.
It will be up to them to do that, and it will be up to the mayors to decide where they're assigned.
Okay.
So even though there's a formula for how many they'll get, that is not, they will not determine that, but they will determine where the AmeriCorps and the Vistas will be assigned.
Okay, very good.
Yeah. For some, that'll be right in the nonprofits. For some, they might just keep them in the mayor's office or wherever the initiative is being launched
Okay.
from.
Okay, great.
And and any other questions on that? Tim, you want to talk a little bit more about the results of the summer initiative, how many contracts we've received so far, et cetera?
Well, we have everybody in and everyone's up to be processed. Only 2 grantees opted out at this point. And we're starting to get payments coming in now. So we're looking pretty good. So some are interim, we might get a couple, up to 2 payments each. So they're trickling in the payments, so we haven't been deluged yet, but worked on it last week.
Right.
So I expect by the end of this week, early next week, all contracts will be approved for summer initiative.
Great. Is there, in terms of reimbursement, Tim, is there anything that you're seeing that might be helpful for other people to know right now in terms of vouchering or the reimbursement process?
Well, everyone's been good. I mean, they've been sending in the program progress report. They've been sending in a financial report, sending in all the documentation.
Good.
We only had like 1 issue, but we still have to figure that out. And all the backup. Just timesheets have been, the backup to the timesheets have been a little bit, we've asked for more information, just so that we can see exactly the time charts, we can match them up to the summary. But other than that, they've been pretty clean.
Any questions about that? I'm wondering if what people heard about that initiative that might be helpful for us to know.
In terms of.
Just in general, how it was received. Is there anything that we should know in terms of future?
I think most agencies, do what they always do, which is they just do it.
Right.
For my agency, it put because of the time constraint,
Right.
it made it difficult. But the feedback that we got from the families was overwhelming. They were very appreciative, and so it turned out to be a really good thing. From our standpoint, and I think a lot of the agencies in the network that did a great job just really responding in a hurry and getting it done.
Right.
Because they saw the greater good in it all. So.
People did respond so well, even though, as you say, that was such a crunch time.
Yeah.
And we do want to make sure we give you as quick a turnaround time on the reimbursement process as possible, so their money's not held up.
Yeah.
We designed these contracts so they could move swiftly, and the reimbursement could move just as swift. So hopefully, people not be burdened with that. But we've heard some good things. We've heard some, some critical analysis, some critical feedback, which is both very good.
Good.
Okay, so Annette, do you want to talk a little bit about the repeat of the HHS survey?
Okay. For those of you who are not aware, Health and Human Services required all the eligible entities to participate in a survey of the administration of CSBG in their respective states. This was done last October, and in February, I believe, January or February, we received the results of the survey, and some of the results were less than stellar. We didn't do well in a few areas. So as a result, we modified the way we do business in terms of contracting, monitoring, issuing payments, the process for obtaining input on the state plan. We revised our policies and procedures, and we took that information back to the network. And in September, we reissued the HHS survey. We asked everyone if they would to please comment again on our changes to policies and procedures and to see if our scores would improve based on the changes we made. The survey was put together and distributed by NISCA to ensure confidentiality and anonymity of the people who were responding. And unlike the first survey, where only 33 of our grantees responded, to the second survey, we had over 40. I don't have the final results of that survey yet, but I did get a preliminary report, and we do seem to be doing better in terms of the scoring on that survey. I've met with the grantees at a couple of different events, at the NISCA annual event in June, and more recently, where was I in October?
Oh, you were in September at the RPIC.
Oh, yes. And I did a presentation at an RPIC event where I met with some executive directors at the NISCA board meeting to share some of the results. And from my perspective, I think we're doing better. I asked those of you that were present at those meetings, Dan, Dennis, Tina, you were there. You've participated in just about all these events that I've initiated, and I'd ask for your feedback.
I mean, I filled out the survey, obviously. I don't think that my survey results changed, just because I think that the consistency in Western New York has always been there. So we probably didn't see an awful lot of change in my feedback. But certainly I think that the fact that we have a newsletter that comes out on a regular basis, the level of communications increased, I think that's all positive.
I was able to participate in the second survey more easily than the first, and so the tool itself, I think, improved. I also think that the support, the technical support, continues to really be strong, and appreciate that change as well. So if I were to think about where I was when the initial survey went through and where we are now, I see a lot of improvement.
Anybody else care to comment?
No, I agree with Tina and Andrea. I think the feedback and the response that we get when we need technical assistance is there. And I agree with Tina, the newsletter is really helpful, not only for me, but for my finance department and for program directors. So they can start making the connections in their mind about the importance of the PPR and all of the kinds of things that are going on at, at a level that they've never really participated in before.
Great. Okay. Does anybody have any other questions or comments on the survey of eligible entities?
I'd just like to say that I agree with everybody else and like to emphasize the newsletter. It is valuable. I forward it on to my senior staff and I utilize it myself, so it's appreciated. Good communication.
Great. Okay. Okay, Ryan,
I just want to say, Annette, on the survey, one of the things is that since we're doing lean, we did a few lean initiatives. One of the things that we've really been driving home to the staff is the notion of customer service, and that we have multiple customers, one of them, our primary one, being the network. And how do we communicate more effectively with our customers? How do we give our customers more of what they need and try to minimize or to reduce less of what creates or interferes with productive and swift service delivery. And you do that within the context of the fact that your first and foremost mandate is the monitoring and regulation, oversight, training, and technical assistance of the entities. That can be a very hard line to walk. We know that it's very difficult to license, for example, in daycare. We used to have these discussions a lot. We license, and then at the same time that we license, we're responsible for deregulating or delicensing. And so what does that say about what we said initially and what we're saying now? So we had many of those discussions, and much of what you're seeing is the result of that. But I don't think from my perspective, as a researcher, you don't anticipate that people will change their minds as much, that what we looked for was a broader picture of how people felt. So the fact that the survey went from just 33 people responding to over 49, or over 40, getting closer to that 49, is what we were really hoping for, so that we could get the big picture of what it is that people were looking for, and people wanted more and people wanted less of. Anything else on that? If not, we'll move on. Okay. We have 3 reentry projects. I think I talked a little bit about them before. I just want to give you a little more update on those. Those are pilot projects, governor's initiatives. I'm very excited to say they're happening in our CAAs. The reason that they're happening in White Plains, Schenectady, and Syracuse is that there was a survey that was done, and in the survey, these were the 3 housing authorities that said, yes, we will go, we will take a chance, work in a partnership, and accept for tenancy people re-entering into coming back home into their communities. So these 3 sites, they're moving along right now. We're developing work plans and budgets, and the startup date is January 1st. We still do not have White Plains completely firmed up, but we're hoping that by the end of the month, they will have been able to work out some of the issues on their ends at the Housing Authority. As far as our CAA Westcott, they are ready to go. So it's very exciting. The governor, I'm hoping, will announce those, and that by the end of the year, we'll be able to report some good results that can be used across the state, if not across the country, to motivate people to take more risk and to do this. We know that when people come back home, they're less likely to reoffend or to go back for the same crime that was once committed. People prosper more, they're more successful. Family reunification, right? Any questions on that pilot project? I'm sorry. Any questions? And then on funding to tribes, Annette, did you want to say something about that? You or Tim?
The Seneca Nation has expressed an interest to be considered for funding again. As some of you know, they backed out back in 2011. They were contacted this year to see if there was interest, and they did express an interest to be funded again. So that brings our total to 4 grantees, 4 tribes.
You know, maybe some of you are not familiar, but in terms of the Indian nations, although they are not considered eligible entities, they are considered discretionaries. We do try our best to provide the same level of training and technical assistance so that we can make sure that services are being delivered on the sites as effectively and to maximize the usage of the CSBG dollars. I'm excited that the Senecas have rejoined our team. It gives us another opportunity to use CSBG funds to serve high need populations and to expand our service delivery.
The other three, two are on Long Island and one is up north.
Yes, the Mohawks are right there. In fact, the Mohawks, if you ever get a chance to visit them, their site spans, their reservation spans 2 countries. And so it's very unique and complex, their service delivery.
Yeah.
Yes, it's very interesting.
Yeah.
Just on, OSC has now approved contracting with all 4 groups, so those will go out shortly,
Great.
contracts.
Any questions on that, on our native contracts? There's just one other thing, if you don't mind, I'm going to add an F here after my E, and that is on ONA or on BIA training. There are many of our CSBG entities who have gone to BIA training to be certified, to be able to provide services, immigration services in their CAAs. They would be able to help with naturalization applications. They would be able to provide support to this population. We now have a sizable group of CSBG CAAs that have gone to this 40-hour training. And so we have a student who is doing this as this is the only thing she's doing as her project this year. And what we're doing is we are going to be working with our CAAs who have gone through those 40 hours of training, and we are going to be helping them walk them through the application process. What we're hoping that will do is help meet our target of getting 10 CAAs to be certified, which I think would be quite an accomplishment for our network. A big accomplishment. It will also position our CAAs to be very competitive in this field and to really maximize and expand service delivery to areas they have not traditionally done so or been able to do. This, of course, will be at no cost to our CAAs. So we are going to be organizing in November a training on the application process. We will have people from the Bureau there to answer any questions. And we did have a CAA who last year did try to apply and came across some issues. So we are going to talk about that and how to get over those hurdles so that once our CAAs submit their applications, we know that there's a very high likelihood that this one will go through. So we're very excited about that. I want to encourage people in areas where they have immigrant populations to consider being BIA certified. Once again, we have the network, we have the infrastructure that will provide you the support that you'll need, and it will also lend a legitimacy that will allow you to expand your service delivery and reach even further into your communities.
Great.
Yes, we're very excited about that. Looking forward to people. We've sent several emails out, even if you had not had a chance to respond. If you're at all interested in this, let us know and we'll make arrangements for you to attend the 40-hour training if your staff hasn't done so. We'll make the webinar available to you, so before you even make the commitment, you know what's involved. And then we can discuss it with you a little further. So if you know anyone in the network who's interested in that, let us know. Send them to us.
Okay.
That's
Annette?
it for me.
Thank you, Veronica. You're
Dan,
up.
I noticed a couple people came into the New York City office.
Oh, yeah?
I can't tell who.
Okay.
Mr. Did we have
Okay.
new people?
Okay,
Yeah.
who's that? Waving in the back.
East Villas from Brooklyn.
Oh, okay. Eves Villas is here, okay. And the woman sitting in the front with the yellow?
Miss.
Oh, hi, I'm
That's
office
Charlie.
manager. Yeah, I'm
That's
talking
okay.
with Faith Hattie.
Okay,
Yeah, she's
thank
just
you.
sitting in Hattie's place.
Okay, well, we still don't have quorum. Sorry about that. I know, I was trying. Okay. My report on the update to Across and Tracks in your packet. For those of you who have a packet, it'll be on the right-hand side pocket. This is the result of the annual compliance review and also the triennial compliance review. This year, in 2016, 32 agencies had to participate in the annual compliance review, and the other 17 eligible entities participated in the triennial review. So every year, everybody's going to have to do one or the other. So these are the results of the scores from 2016. We had a total of 20 grantees meet all 58 standards. That's 58 for private CAAs. The public CAAs, DYCD and Livingston, are only required to meet 50 organizational standards. So anyway, we had 20 grantees meet all 58, and 27 grantees met more than 50 of the 58 standards. So as of the fourth quarter reporting, you'll note in the bolded print, those are the scores for each region based on banding of either 50 to 58, 40 to 49, and below 39. You'll see that there was progress. If you look at the score that says below 39, when we did the initial across, we had 7 agencies that fell below 39 initially. And after being provided with training and technical assistance and having more progress on their own, only 1 agency continues to have a score below 39. We're supposed to report to HHS the number of our grantees that meet the 58 standards. There seems to be a discussion afoot that it's not fair just to report only the agencies that met, the 100% of the standards, that the whole network should be reflected in the scoring. So we're waiting for HHS to tell us whether they only want to know which 20 met all 58 standards, if they want to know how all the other grantees fared in the assessment. We are now in 2017, started October 1st. We will be sending out the across tools for agencies to complete again this year. They have to do it every year, even though the standards don't change and the format doesn't change. They have to be certified every year based on the 58 standards. So the new across tools will be going out maybe by the end of this week. And we are starting our track reviews for 2017. And as a matter of fact, I'm going to Elmira later this week to assess Andrea's agency. Any questions on the organizational standards and our review situation? Yeah.
Comment. I appreciate the state wanting to encourage HHS to consider how all the agencies are coming into compliance even if they haven't yet met all the standards. And you said that you will shortly be sending out the new across tools for the agencies that will be doing the tracks. I believe that there have been revisions to that tool as well, right? Yes, so has or will a new tracks tool be going out shortly as well?
Yes. The tracks tool was modified to remove some of the indicators that were redundant. The one for the private sector was done, I want to say back in June or July, and we've been modifying the one for the public CAAs. That one has not been sent out, but that should be coming out this week as well. There were no changes at all to the across tool. The across tool remains the same. It's the tool that was created by the Community Action Partnership, so there are no changes to that.
And that,
Yeah.
for the agencies that scored less than 58, what happens at this point? Do they have a corrective action plan? Is it caught up at their next across? How does that work?
We will continue to do the monitoring on the tracks even after the across is done, because the tracks have the state indicators.
Okay.
So, and we actually have a couple of agencies that have met all 58 standards on their tracks, but still have unmet indicators, because as you know, we added more compliance compliance requirements on the tracks. So you will continue to have a continuous improvement plan on a tracks, even though you're going into a new across. Your analysts will be monitoring in the first quarter for those agencies who have not met all 58 standards, the 2016 across as a closeout for 2016. So when they come out in October, November, December to do your regular visits, they will be monitoring your across from last year, which should be helpful as you put together your across for 2017.
Okay, thank you.
Okay.
Any other questions? You don't have a NISCA report?
No, Carla said, Carla will not be able to be here, but she said she would submit her report.
Okay, very good. And Pat, are you on the phone?
Yes, I am. Hi, everybody.
You're up.
Okay, I'll be brief. The meeting of the minds held in May went very well. We had 72 people, I think, attended, which was a full house. I don't know if we could take any more. Everybody seemed happy. We shared 9 best practices this year, and the statewide project is going better than expected. I did hold the mini meeting of the Minds downstate because several of the downstate agencies had attended the Syracuse meeting. There were, I believe, I can't remember offhand, but I believe 6 agencies that attended, including New Jersey, came. I was able to back up for all of them. I supplied 8 years of material, booklets, everything that was distributed to the other agencies over the last 8 years was handed out to them. They seemed very happy with the meeting. I'll be sending you all of the feedback. Was all positive. All wanted. I asked them to name trainings that would be helpful, and they all, pretty much all wanted more training and a longer period of time. The children's disaster training, again, goes very well. It brings together so many partners, and I was happy that I was able to hold it in Portland this year. And I believe there were 4 community action agencies from surrounding counties in attendance as well to take the information back. What we find is where we're connecting with the children's disaster assistance people who are really the experts worldwide in children's disaster, the more we're seeing the possibility of a really strong collaboration between them. And one of the reasons I haven't submitted the report and all the information on children's disaster that I want to get out to everything we've learned, and just information that would be so helpful to agencies. But in almost every area that we've gone into, the Red Cross has been very happy that we're doing this, because they also see that there's this lack of focus on the children during times of disaster in New York State in particular. So each time that we've held this, we've been contacted by the EMS people who are so excited to know that there's a place to go, that the people will be trained to handle the kids. So right now, one of the things that we've been doing is the material, the storybooks and work materials for young students. This past one, Circles, it's called, is a tool to build empathy with the focus of creating the next wave of volunteers. Because they're finding that there is a correlation, and there's not many studies done, and that's why we're doing this. There's a direct correlation between children between the age of 5 and 4th grade. If they develop empathy and at the same time have early service learning, their chances of graduating high school increase, and there's an extreme drop in early incarceration in those kids. So the materials that we created in Circles were meant to do this. And we have 10,000 books that are being distributed around New York State through community action, to schools, anybody that works with children. Right now I'm piloting in our court system. I'll be meeting with all the judges, all the lawyers, all the child advocates in the court systems, and they're going to use these books because they really, where the need is for the at-risk children to learn the empathy that they're not learning in the home because of the stress level that they're under. So right now I'm on the side of the road, headed to Penn State, where they've asked me to come in to do a presentation to at the Pennsylvania Early Learning Summit on this topic of empathy. So we have all the materials that we've distributed in New York State to share with Pennsylvania, and Kevin and I created a video that will be not only shown here, but we will pass this video throughout all the people that are community action agencies and that are taking part in the Circles project. They will have this video to take into the schools to show teachers, child care centers, anywhere there's children at risk, the importance of catching these kids early to prevent that early incarceration and for them to be more successful in school. So I don't know if you have any questions. With technical assistance, I still get emails almost every day, and we create graphics for different agencies that are trying to promote Head Start and some of their programs. And I'll be going back up to Seneca Cayuga to be doing a training for them in November on volunteer development. So, any questions?
Anybody have any questions for Pat? Okay.
Safe travel.
Yes, thank you.
Good for you for not texting and driving.
No, I pulled over, so I'm all set.
All right.
I decided, I don't know why I thought it was tomorrow, but that's good that I had everything in my car.
Okay, thank you very much, Pat.
Okay, bye-bye, everybody.
Bye-bye. Any old business? Any new business? Next meeting date? Annette, do you have anything in mind?
No, I don't.
Okay. You want to wait till the dust settles with vacancies and all that?
I think that would be a good idea.
All right. Okay, maybe you and I can talk about seeing if, checking in on where we're at, in a few weeks maybe.
Okay.
All right. Any other new business? A lot.
Why can't, I just went to my legislator when I got appointed.
Right.
Can't some of our colleagues do the same thing?
Well, the problem right now is that there's a process. Says we have to have people removed first.
So there aren't vacancies.
Well, there are. Well, there are vacancies, and there's also.
Why can't the vacancies be filled by the building?
I believe most of the vacancies are on the assembly side, and that is much more difficult a process.
Okay.
Although hopefully the appointments office will be able to help. Okay. Anything else? Do we got a quorum. I'd ask for a motion to adjourn. That's good to see everybody.
Use your authority and adjourn the meeting, Dan.
We're adjourned.
Thank you, everyone.
Thanks a lot.